and turn and chin arch back. Pull your shoulders away from your ears. Come back to center. 1, jolly good. 3, squeeze around. And 4, squeeze around. Up and turn. And 2, squeeze it up and down. And it's bend to that side for 8. And
that was awful. Oh, that was terrible.
It was really a hard one.
That was really hard one.
Got a week to
I will start it. Hello, this is David Dutton, who is a doctor who cares a lot for cancer patients who are predominantly older people. So tell us what you think about exercise, David.
Yeah, so thanks for asking me on to talk today, Nick. So I'm a consultant haematologist and I deal with patients predominantly with blood cancers, and that means patients as they get older usually. And I see a lot of patients with huge variability, from those who do very little activity to those who do actually nowadays an awful lot. And I can see there's a great difference in their quality of life and their ability to live and function normally. So it's a really important thing we're talking about today, Nick.
Yeah, you came over and watched us and took part actually in doing one of our exercise sessions some time ago. How useful do you think that sort of thing is?
Yeah, thanks for asking me to that, Nick. It was really good fun, first of all. We really enjoyed it.
You watched me having a miserable time.
Nick was working very hard, yeah, as was Jeannie. There was and what I loved was Sammy got you working hard, moving all parts of your body, doing resistance training where you were having to work against weight, even your own body weight,
yeah,
and also getting the heart rate up. And I thought it did a great job, and it was so social and friendly, even online. But everyone enjoyed it, including myself.
Yeah, well, it was good, and in some ways we enjoy it, and in some ways it is absolutely miserable.
Yeah, it's hard work, but it's good.
It is very hard work. So what we decided to talk about was a bit about muscles.
Yeah, that's
so
right, isn't it? Yeah.
Can you have a little talk about what happens to muscles?
Yeah. So muscles are the body's way of moving us around. So they're attached to our bones and they squeeze, and when they squeeze, they bring our bones forward, and that helps us move and helps us stay stable as well. So that's a really important thing, balance.
Yeah.
And I imagine them to be like little bags of strings that go together. And these strings, when you're younger and fitter, they're big, juicy.
Yeah.
And as you get older, unfortunately, they can get smaller, less juicy, and the electrics that go into them that help them to fire, they wither away a little bit as well.
I see that. That's really bad news for muscles. So working them has a good effect. Does it improve the electrics or not?
Well, amazingly, Nick, it does all those things. Yeah, even from how we look at them from the outside, how big they are, and we can all look down and see what our muscles are like. There we go, and you can feel them on your thighs. Yeah. And when you work them, the body says we need to work it harder, and therefore we need to keep them strong, and therefore they remain bigger and juicier, and the electrics keep firing too.
So Nick, what I'm showing you here is a picture of our muscles and bones. So this is like we've taken a slice through our arm or our leg here, and we're looking from the end on. The white bit in the middle is our bones. You can see that there, and the skin's the outside here, and this red bit here are all the muscles that help you move. And this is an example of someone about 40 years old.
Yeah.
But unfortunately, as we get older, if we don't do anything, what happens is the bones stay roughly the same but get a bit smaller, and the skin on the outside stays the same, but what we can see here is that all the red bit in the middle has all shrunk down. And that's what happens if we don't use our muscles. They get smaller. And therefore, it's got this big fancy name. We don't use it very often, sarcopenia. And it really means that you haven't got as much muscle as you used to. And when you haven't got as much muscle, it means you're not as strong.
Yeah.
And it means you might fall over if it gets to a very small amount.
I see.
And this is what we're trying to prevent, Nick.
Yeah, I see. So this happens to all your muscles, your leg muscles, your feet muscles, and everything else.
Every
does
muscle
it?
that you don't keep using.
I see.
But there's good news.
Yeah.
If you use them, they'll stay big, or whatever stage, and you could even get them bigger too. And this is what you've been doing with Jeannie. You've been trying to get them bigger and stronger.
Yeah. Okay.
As well, if they get damaged.
I see. That's rather amazing. So, so one of the things as you get older is you want to lie down and stop quite often.
Yeah.
So we just have to live with that, do we, and fight against it? Or
You've got to keep fighting against it, Nick, yeah, and work hard. We know that after the age of 30, the muscles start to go down by about 5% every 10 years if you don't do anything about it.
That's
And
a lot, isn't it?
It's an awful lot. And when you're working hard and your body's saying, I'm tired, it's the body's way of healing and repairing and building them back up again.
Yeah, I see. So, so this is all bad news for me when I want to stop. And I've just got to keep on doing this.
Keep going.
Forever.
You can't stop.
Not forever, it won't be forever, but
As much as you can.
until I'm stopped. Okay, thanks, David. Well, that's lovely.
Once a week, every week for the rest of our lives.
Oh, God.
Or we'll be in a wheelchair. I'm
Yeah.
sure.
Anyway, there we are. We do our best. And everyone who watches this video should probably do something about the same as us.
Yes. And I'm 89.
You're not 89, you're
I'm 87.
You're
and you're
87. I'm 89.
I'm 87.
I'm 89.
And he's